first agenda today, I'm going to introduce Kathleen Brewer, or Kathy Brewer. She's the founder, CEO of ECDGA, Global Alliance, ECD Global Alliance. And also Paul Hendrie. He's a hematologist at the University of Washington, Fred Hutch Cancer Center. He's also a board member of ECDGA. They're going to talk about the history of ECDGA and a focus on the future. Kathy? Paul?
Good morning. Can everybody hear me okay? So thank you all for being here. We really appreciate it. It's great to see the wonderful agenda, and I have to thank our wonderful host here, Dr. Go and Dr. Goyle. They have been 4 years in the planning of this meeting, and they have been just so gracious every step of the way. Thanks to our sponsors also, and to our staff and our board of directors who are here. We'll introduce them a little bit later. But what I was asked today to just give a little background about the ECD Global Alliance. I think most of you know it, but some of you may be new, and so I'll just go very quickly. My story started with ECD when my husband became ill. He was very active, led an exemplary life, but in 2002, he started becoming very ill. He went through a lot of issues, and unfortunately, every step of the way, we missed the diagnosis. And that was not anyone's fault. It was because the disease is just so unknown at that time. So he went from a very healthy person to actually needing 24-hour care. And what that did, I found out the diagnosis on his autopsy. And those 5 years of my life led to many emotions all over the playing field. What I learned is that you have to have hope no matter what. And so when he passed away, and I apologize if I get emotional, I don't do this well. When he passed away, the thought was, we have to keep going. I had promised him we would find out what was wrong and we would fight it. So thanks to some very brave people, some of the patients and caregivers found each other on message boards. You have to realize this was in 2007, in the time before Zoom. And so we began doing typing chats. Through those, we had some conference calls with some medical folks. We were encouraged to build a website, and we quickly realized the need for a nonprofit. So you see an excerpt here from the first chat, where we were just so thankful to be able to talk to somebody who knew what the heck Ertime Chester meant, although we had very little answers. So as a group, we began searching. What we wanted was knowledge. We wanted answers for all the questions we had. We wanted to find knowledgeable doctors who could treat patients. We longed for treatments. And of course, everyone wants a cure. So we started out with some really big ideas. We wanted a global community that worked together. And guess what? We're here today. Thank you. Mission accomplished. We wanted funded research. We wanted people to be looking into this disease and trying to understand it a little bit. Thank you. That's what we're talking about today. We wanted available treatments. At the time, I was told by people much smarter than me, much more educated, to never really hope for an FDA-approved treatment. Just showed me that sometimes that we can hope for the impossible and achieve it. Thank you, Eli. We hoped for dedicated doctors, people who would actually spend time and have time to talk to patients and understand what they were dealing with. Thank you all. You've accomplished that. And to all the care center doctors. And we hope to have regular meetings of scientists and patients. And again, here we are. So it is an amazing journey. We've been 15 years. And thanks to you, thanks to the courageous patients, thanks to the dedicated caregivers and our generous donors, here we are today saying we've accomplished so much, but yet we still have so much more to accomplish. And so what I'd like to do is introduce Dr. Paul Hendrie from Fred Hutchinson Center. who's on our board of directors, and he's going to talk a little bit about the future and where we're headed. So thank you very much.
Yeah, we can give Kathy more applause than that, can't we? Come on, wake up here. So, yeah, I'm Paul Hendrie. I'm a hematologist in Seattle now at the Fred Hutchinson Cancer Center. And I'm relatively new to the board in 2019 and kind of humbled to talk after Kathy here. But I've been part of the research committee chair, and, many people in the room have jobs like I do, and, our FTE effort and stuff, and whether it's research, academics, or patient care. But the time I spent volunteering with the organization is probably the most meaningful time that I spend. So thank you, Kathy, for letting me be part of the board. This is just a 1,000-foot overview of some of the accomplishments. Oops, this slides must be on times. You're doing, Ron? So this is just a 1,000-foot overview of some of the accomplishments in the ECD community. And you guys all had packages today, and it has some historical documents there on going back. But the first paper was published back in 1930s. And in the early era, I guess, from 78 to 2007, the prognosis was pretty poor. And it's a very difficult life and short life for these patients. And there wasn't a whole lot of publications out there on this disease. And in 2007, the first treatments were developed, and it improved the prognosis some, getting to maybe 5 years, but still the quality of life was not very good. And so along came Kathy, as she stated, and the ECG Global Alliance was founded in 2008. The first grant was awarded in 2010, and the NIH Natural History Study was opened in 2011. These were all very important initial advances in the field. And so in 2012, the genetic mutations were found, and this prompted a remarkable understanding of the disease and being able to move forward specifically in diagnosis and eventually in the treatment. So this was a wonderful time. The first medical symposium was in 2013. The ECD funded a registry at MSK in 2014, and the care centers were established in 2015. In 2016, the WHO declared ECD a histiocyte neoplasm, and this was helpful in getting the word out to hematologists and oncologists across the country about this disease. The first FDA-approved drug was in 2017. Again, remarkable for a rare disease like ECD to have FDA approved. And then, so in 2020, there's over 100 papers that were published on this disease. So it got known. The NCCN guidelines were published in 2021. And then now a second drug. Again, this is a rare disease, and we actually have a second drug with an FDA approval. Again, very remarkable. So we need to continue to move on. We need to continue to work on early diagnosis. We need to improve access to all patients across the world. We need to lessen the burden of the cost of the medications and the care. We need to see how do we get people treated and then get them off treatment. Get to the cure point. How can we make sure that every patient has a treatment possibility? So much research needs to be still done there. We need to continue to improve the quality of life. Even if we can treat the disease, there's a lot of complications that need to be managed. And then now we talk about survivorship. This is wonderful in oncology when you get to the point where you're talking about survivorship. You're not just treating the disease. And we need to continue to get the information out there so everyone has access, both new patients and providers. Some of the program and accomplishments for the ECDGA are listed here. This is the 8th Medical Symposium Patient Care. gatherings. One of the unique things about this is that they're together. You know, we go to a lot of meetings as physicians and we're researchers and we're the only people there, but this is nice that it has to combine. We also have 5 regional meetings. There's awareness out there on booths at specialty conferences and grand rounds presented across the country. We have websites and medical patient brochures out there. In the package, there are 2 of the brochures, so the patient and the physician brochures out there. There's webinars. And then part of the group that I've been involved with the research actually funded over $1.2 million in research. I think that's pretty remarkable for an organization this size. There's 34 care centers across 14 countries. Again, maybe might have been somewhat naive, Kathy, to begin with, to think that, you know, let's call this the Global Alliance, but actually has achieved it, 14 different countries. We've added the patient navigator. Belinda's here. And that's been very helpful for getting the patients to their treatments and resources for them. We now have 873 patients registered from 71 countries. Again, very remarkable. There's chat sessions available where we support 11 different languages, and then name your favorite social media outlet, and ECD has a footprint there. The board has a number of goals. This is a kind of condensed version of 4 categories of goals that we have. One is to continue to get earlier diagnosis of patients with ECD. So much of the work that the people are doing or present here, that if we can get that out. We want to continue to support relevant research to improve the quality of life of patients with ECD and their loved ones. We want to build a stronger global community. And we want to be able to figure out now, how do we sustain what Kathy's done? We're kind of now more of a mature organization now. And so we need to look forward, you know, how do we keep this going and efforts, because there's much more work still to be done. In your packages, and I think it is now an orange card, just to help the ECDGA kind of rank. You know, they're all important, but kind of rank which ones you think is the most important for us to really concentrate on for the board here. And if you can complete that orange sheet and return that in, that'd be terrific. And we need you. We need you to continue to take care of the patients and the families. We need you to continue to do the research. And then we need you to continue to provide the board and the organization, you know, what do we need to do? How can we help you further? We also need donations. This doesn't come without a cost, and there is a card in the package as well regarding that. And so reaching out, you know, when you have patients and families and stuff, and there are possibilities to have donations, please think of the ECDGA. Just kind of a little bookkeeping here on the schedule of the meetings. Tonight, there's a banquet at the Marriott Ballroom 1 and 2 from 6 to 8. There's a Catholic Mass tomorrow morning in the Kayla Regency Room. And then we have the patient and family gathering on tomorrow as well. Quickly, in your package, you also have a map. I guess you all found it here. This is for the people who aren't here. And I'll just finish up because my buzzer is going to go off here. There's a lot of people to thank, you know, in addition to Kathy. We've talked about Jean Pudlow and Belinda Cobb. Renita Page is tremendous, and in the donor relations and DB manager setting. And then the list of all the other volunteers with our group. And then thanks to Ron and Gaurav, our wonderful hosts. Thank you to the other people on the board here. And then for you, physicians and scientists that participate in our medical advisory board, thank you as well.